I'll set the stage with only a few slides for the topic of discussion, which is effectiveness of the risk management process. Now, I've been thinking about this for quite some time now. This question of effectiveness, because it is a requirement of ISO 14971. So how do you do it? How do we make sure it is suitable and effective? So I'm very curious about it and would love to hear your perspective and views, challenges that you face in trying to answer this question, and what best practices you have in your organization. Let's share them all. So I want to start with a question of the day related to the topic, and I put a poll on LinkedIn a few weeks ago. Got some interesting responses. I'll share that with you as part of this slide deck. But the question is, which factor is most important? Most important. You have to pick one when you evaluate the success of your risk management process. Now, I want you to pick one based on your current practice, not what you think it should be. I'll share with you the LinkedIn poll responses, which I have a feeling that people answered that with a view of what they think it should be. But I would like you to be honest. If you're not having a particular factor or criteria, that's fine. But if you have, what is most important for you? So here are the choices. 1. Time to market. 2. No audit findings. 3. Fewer adverse events. 4. Patient-doctor satisfaction. And 5. Other. Please explain. So here's the question of the day. Please take a moment to think about it. Put down in your comment, what is the most important factor that you consider as you evaluate the risk management effectiveness in your process based on current practice, not what you think it should be. And I'll share with you the LinkedIn poll results I got in just a few minutes. Okay, so here's the requirement. Top management shall review, shall, so it's not optional, shall review the suitability of the risk management process at planned intervals to ensure continuing effectiveness of the risk management process, and shall document any decisions and actions taken. So let's play out this scenario. It's a requirement of the standard. And let's say you are required to conform to this standard for regulatory purposes or for your own QMS. And let's say you're going through an audit and this question is asked to you. Well, could you please share how your top management evaluates the suitability and effectiveness of your risk management process and what actions are taken? How would you respond to that question? Would love to hear that. So those of you who do not know me, I should tell you that I really pay attention to terminology. And the first thing I do when I try to understand key requirements and key terms, I go to the dictionary. English is not my first language. And even after many, many years of working in English, speaking in English, I take time to understand what it is supposed to mean in daily conversation or language. Forget about ISO 14971 for a moment, but let's see what it means. So here's what Merriam-Webster dictionary says. Suitable. That's one of the key words, right? Adapted to use or purpose. Adapted to a use or purpose. What is our risk management process used for? What is its purpose? If we know the answer to the question, we can figure out if it is suitable or not. Effective. Okay, so definition of effective is producing a decided, decisive or desired effect. We need to know what we desire it to do. What is the effect we are expecting it to produce before we can say it is effective? So those are the two definitions of keywords. Keep them in mind. So here's the LinkedIn poll I did. I asked the same question to my network. Time to market, no audit findings, fewer adverse events, patient-doctor satisfaction. 87, not a scientific poll by any means, not a scientific poll. But most people responded, 68%, fewer adverse events. Some people said 9% about no audit findings. Some people said time to market, patient-doctor satisfaction, 20%. So I've worked in this industry for many, many years. To me, this is what we think it should be. 68% plus 20%, that is close to 90% of my network folks are telling me that the most important factors are fewer adverse events and patient-doctor satisfaction. This is the desired effect we want. Are we measuring it that way? I pose that question to you. I'm skeptical. So I'm asking you to consider this and share your opinion and thoughts in the chat below. So that's our poll of the responses, and I want to share with you one comment. We received many comments, but one comment that was particularly insightful, and I want to leave that as the last slide for you. So LinkedIn poll comment: I believe that the management approach to risk effectiveness is more implicit. I think I agree with that. I haven't seen specific questions being asked about effectiveness, but the expectations of risk control measures is that if they work, then it results in the reduction of the overall risk levels, which is what the management reviews. And this metric works well for both pre and post market risks. So this person is actually being pretty honest, and they are sharing with us that management does have expectations from risk management, but it is more implicit, not explicit at all. So it's, I'll tell you when I see it kind of an approach is the way I look at it. So it's implicit. I'll tell you if it's effective or not when I see it. And maybe one of the factors they are looking at is, have we been able to successfully reduce our risk levels throughout the product life cycle? Let's say we went in for a brand new innovative product with a slightly higher risk level, but still favorable compared to the benefits, which is what the standard requires, that the overall benefit should be higher than the overall residual risk. Maybe we were okay, but we are not happy with that. So are we seeing continual risk reduction over time? If we see that, maybe our process is working. I think it's fair to say that, but it seems to be implicit. So I think this is the view that I have. Let me know if it is a correct view or not. What is it like in your world? How does it feel in your practice, in your organization, when you review information with your top management, as is required by the standard, who has to make a judgment about the suitability and continuing effectiveness of the risk management process? How do you feel? Do you feel that discussion is pretty clear and open, and everyone is happy about that? We clearly say that we have reviewed that and have judged that the process remains stable and suitable and effective. How is it like in your world? So I would love to hear from you. Make sure you share your opinion in the comments whenever it comes to your mind, because that's the whole point of this conversation.